These injections are starting to really get tough on me. I don't feel like the eye we're treating is actually even getting any better. I mean, I don't notice any difference.
So, as a retina specialist doing a lot of treatment, this is something we hear all the time. It's really hard for patients. It's a lot of treatment burden for patients. And there's going to be a natural point where they feel we call it injection fatigue. And that is they're coming in regularly and they often have to arrange transportation and there's stress. They're getting injections of medication into the eye and it can be stressful and tiring for them. It's important that they feel heard. It's important that we talk about and acknowledge that it is stressful and that it's okay to feel that, but also that we again and again point out why they're here and why it's important. This patient mentioned something that we hear commonly, and that is that he doesn't feel like the vision's getting any better. And it's important with this particular patient being treated for geographic atrophy that we emphasize over and over again that we can't make it better. Our goal is just to slow this down as much as possible. And unfortunately, even though we tell that often to patients, they sometimes forget or they heard it at the first visit and their mind was wrapped around all the other things that were going on and they forgot. And then a couple of visits later, they're asking why things haven't gotten better. Or they might be asking a couple of visits later, why is it still getting a little bit worse? A year down the road, they might say, hey, I'm starting to have a little more trouble. And so it's really important that we remind them regularly that we don't expect the vision to get better. This is as good as it's going to be. And we do expect it to get worse at some point. But our goal here is just to protect as many healthy retina cells as possible and to slow down the disease as best we can.
Well, John, I know it's hard to come in and get these injections, but this treatment is all about slowing the disease and preserving the vision you still have.
So the patient acknowledged that he isn't seeing any benefit to the treatment. His vision isn't getting any better. And also, mentions the injection fatigue. And the doctor acknowledges that it's hard to come for the injections, which is nice. But I think it's important to probe a little bit further with the patient, because if we can understand why the patient is having injection fatigue, why the patient doesn't want to come in for treatment, then hopefully we can solve the problem in certain cases. So it might be that the patient has trouble getting transportation, and it's possible that there are county transportation assistance for seniors or Uber or other things that we can do to help facilitate patients getting to the office. It's also possible that the patient has something as simple as dry eyes, and so they feel irritation afterwards. And helping treat their dry eyes will make it easier for them to come to the office and get their injections. So it's important to ask a few additional questions for the patient and get a sense of why it is that the patient doesn't feel that he can come anymore. And the second part is that the doctor does a good job of mentioning and reminding the patient that the treatment is not going to make the vision better, and that the goal here is only to slow the progression of the disease. We definitely talk to patients about this all the time, but a lot of times in that first visit with a patient, they're thinking about the idea of an injection, they're learning about the disease, and it's hard to retain everything. And so even though most of us will say this treatment is not going to make your vision better, our only goal here is to preserve retinal cells, preserve as much as possible, and slow down the progression of the disease, a lot of times patients will forget. And whether it's visit number 2, visit number 4, visit number 6, at that point, a lot of times they will ask, well, why am I not noticing anything better? Or they might ask, why has something gotten a little bit worse? And so we have to remind them that we expect this condition still to get worse over time, and that we're just doing the best we can to slow the progression.
Will stopping the injections cause me to go blind, or will it make any difference?
If you remember when we first started the injections, GA can still progress even with treatment. Our goal is to protect what vision you have for as long as we can, and so I do strongly recommend we continue these treatments for as long as we can. We'll work through it together.
So one thing, the doctor uses the term GA. Our patients will often forget terminology, so we want to simplify things as much as possible. But that's a tough question from a patient. Am I going blind? Am I going to go blind? And as the doctor, you want to provide hope and optimism, but at the same time, you have to educate realistically. So I think sometimes a nice in-between hedge is the best way to go. So I usually say to a patient, I don't have the crystal ball. A lot of times we've been following the patient more than once and we've seen some progression before we've started treatment. So I can say to the patient, we saw this progression, we looked at it together. If we need to, we'll pull the images up and look at them together again. Then we can say, honestly, we know there's progression. It's likely to continue to progress. I don't have the crystal ball to tell you when you might lose some vision or more vision or have significant issues with certain daily tasks from your vision. But then at the same time, I usually finish off by telling them that even if someone does lose their central vision, you still have the peripheral vision. So when patients say, am I going blind? Sometimes they mean, is my whole world going dark on me? And if you want to end with some optimism, it's always nice to say, well, even if you do lose your central vision, you still have peripheral vision. The entire world isn't dark on you. And there's an optimistic note that you can finish off with there. So that concludes that patient scenario, and we'll move on to the next patient scenario.